So, as you'll hear in my voice, I unfortunately have a little bit of a cold today. So you might hear me coughing, and it's just that the germs at my children's daycare are very generous. But the worst thing about having a cold at this time of year is that it really makes it quite inconvenient if you want to pick your nose. It's just incredibly painful. So if any of you in the audience could lend me a finger at some point in the presentation, that would be really incredible. My wife encourages me not to go out when I look like this, but I told her that it was an audience of caregivers and people suffering from memory complaints, and as a neurologist, she also understands the importance of that. Does anyone here in the room know a caregiver or is sitting next to one? All right, let's have a round of applause for the caregivers in the room. You are valued, extremely valued. These are some of my favorite caregivers. On the left is my grandmother, who passed away at the age of 99 with Alzheimer's dementia. And although she was in more severe stages, because of the efforts of my uncle, who kept her at home, she was able to play poker even until some of her last days, which was one of her great delights. She was a big frequenter of Atlantic City. And on the right is my father, whom my mother cared for, and also suffered from a form of dementia and passed at the age of 78. And in the final weeks, although he couldn't speak, his presence was still there and meant so much to us. He held my young children, and those moments were so meaningful, and it was really my mom who made that possible for us. Many caregivers do experience stress, as our last presenter was mentioning, and yet many caregivers also feel that the opportunity to care for their loved one is one of the greatest privileges that they have. How does chronic stress lead to poor health outcomes? Could you play this, please? This does not have audio, so just look at the text. And if you could move the cursor up. She asked, "What do you worry about?" Incontinence, breathes out. Like what just happened? She's laughing. I think it's just the idea of losing your mind. Okay, so Robin Williams suffered from dementia with Lewy bodies. And as we all know, he did commit suicide a few years ago. And one of the things that really caused him a great amount of fear was this idea of losing his mind. And I think this is very important for us to pay attention to and think about how chronic stress can result in a poor outcome. Something from the external world comes into our brain. So in this case, whatever was Robin Williams' idea of losing his mind, whatever images he had of that, whomever he had seen with that, however that looked to him, that was for him then something that got into his mind, it got into his brain. And with that, he then suffered his negative outcome. What we know from a physiological standpoint is that that chronic stress, as it enters the brain, and here I'm going to get a little technical, resonates within the prefrontal cortex, then sends projections down to areas of the brain such as the amygdala, the subgenual anterior cingulate at the base of the cingulate cortex, and the hypothalamus, and these in turn send signals down to the rest of the body, which have action on the heart, on the immune system, even innervating nodes of the immune system from which immune cells replicate and activate. So it's very profound. And the point that I want to emphasize is that what happened with with Robin Williams and what happens with a lot of us is that these images become so powerful as they live inside us, is that they dominate us. So before we talk about guided imagery for resilience, let's talk about what a mental image even is. Okay? So normally we think about it in terms of its relationship to sight, our sense of vision, how we perceive things in the outside world with our eyes. And that's a component of a mental image. But it also may involve a sound, a thought in and of itself as an internal representation of the world, you could say, as a mental image, or a tune, a jingle that we enjoy, a taste. You could imagine a crisp fall apple, or if you prefer persimmons, it's that time of year too. A touch, that touch of your head at the end of the day, finally touching that soft pillow. Even a smell can be a mental image. And these live inside us. They're constantly occupying our brain. You may have several of them going inside your head right now. So I'd say, quiet down, listen. This is important. These paying attention to these images is important, just as you pay attention to the outside world. And images, as we self-create them, may have different levels of power for us. So I'd like you to close your eyes for just a second and just silently repeat this sentence to yourself. A ton of bricks is falling on my head. Okay, you can stop and open your eyes. So I even heard some laughter in the room, right? So this sentence, instead of inducing fear for some, induced a laughter response, right? Some amusement. So now instead of saying it to yourself, I want you to close your eyes again, and just for a moment, imagine as if a ton of bricks were falling on your head. Okay, open your eyes, and you can let that go now. Some of you might have noticed that you might even flinch in that kind of way. That manipulation of that image is so powerful when you do it visually that it becomes much more striking, and it links into your physiology much more. Now, verbal types of imagery can also be useful and helpful, and we'll even practice a little bit of one of those later on. But the point that I want to make is that it's important for you to match the kind of imagery you're doing to the problem at hand and the subject material at hand. You want to be thoughtful about how you are using images to help yourself. Now, what's the purpose of guided imagery? I think that there are really two ways in which this is used, largely. So in one, we're gaining perspective and control over these internal images so they don't upset us as much. You know, we have these toxic ways of thinking, feeling, these things that come to mind, these things that we dread, the anticipation of certain moments of what's going to be said there, or how this person is going to react, what we're going to need to do in our day. And all of these things build up and fill us with stress. And in guided imagery exercises, we can actually focus on some of these and reformulate how we experience them so that they don't upset us as much, and so that even we can feel empowered within our day. Alternatively, we may be generating positive images that help us soothe ourselves, and we're going to do one of these. And I think this is the more classic form that you might think of as the person imagining themselves walking down the beach, listening to the sounds of the ocean, smelling the salty air, feeling the sand on their feet. Very relaxing kind of image. One of those guided imagery meditative techniques that has been studied both for dementia caregivers as well as people with mild cognitive impairment is called Kirtan Kriya. And Kirtan Kriya is interesting because it involves many modalities. So it involves repetition, a musical repetition of 4 syllables, sa-ta-na-ma. And then combined with it, there's movements of the hand. So one with the thumb touches each finger in turn, sa-ta-na-ma. And there's a tune to it as well that goes sa-ta-na-ma, sa-ta-na-ma. And this is practiced within the clinical trials for about 12 minutes a day. And first people repeat it aloud, musically, and then they whisper it, and then they just imagine the sounds of it. And then at the very end, they imagine light, as if light were shining down upon them and inside of them. And it's a very relaxing, very soothing form of imagery that comes from the yogic tradition. So what's some of the data for it? So in the first study, I'll tell you about 49 dementia caregivers were randomized to either listen to relaxing music, you could say a passive form of relaxing activity, or to do this active form using their brain to both do motion, sound, imagery, light. And there were results favoring Kirtan Kriya in terms of depression symptom scores decreasing, cognitive scores decreasing, excuse me. And interestingly, telomerase activity increasing. So if you look at the image, what you see are a pair of chromosomes under very high resolution, and this is a bit of an artistic representation. They're not actually purple and green. I really wish they were purple and green. Like, who would not want purple and green chromosomes? But the purple illustration is the genetic material within a chromosome, the DNA, and then the green are the telomeres. And you may have heard of telomeres. Someone here at UCSF, Elizabeth Blackburn, one of the few women to win the Nobel Prize, did so for her discovery of telomeres, telomerase, and the whole system of how this enzyme, telomerase, builds up the telomeres at the ends of the chromosomes. So the telomeres are protective. You could say like the little plastic bits at the end of shoelaces. And they get worn down over time, and they become worn down with aging as well. And once they become completely worn down, for example, on your shoelaces, then the ends begin to fray. The shoelaces are damaged. You can't use them anymore. And that's similar with the telomeres and the chromosomes. So as the telomeres wear down, then DNA gets damaged and cells die. So it's one of the ways in which aging occurs. As you age, your telomeres shorten. And so this study found that performing this Kirtan Kriya exercise actually boosted the activity of the enzyme that rebuilds the telomeres, that elongates them, that repairs them. So a very powerful finding. In the second study, for people with mild cognitive impairment, this is the work of Dr. Helen Lavretsky, who was one of my mentors down at UCLA and is a real powerhouse researcher. She took a group of about 60 patients with mild cognitive impairment and randomly assigned them either to receive memory training, a standard memory enhancement training, which is the gold standard these days for averting cognitive decline, retraining your brain. We heard some about that in Dr. Morero's wonderful talk, the importance of cognitive activity, and I would say mental imagery is also a form of cognitive activity. And what the results found was that Kirtan Kriya and the memory enhancement training were essentially equivalent in terms of the memory outcomes. Both of them boosted people who had mild cognitive impairment, boosted their verbal memories. But the yogic practice also improved their executive function in their depression, and more so, than did the memory training exercise. So it had effects more globally in the brain, not just with memory circuits, but also with circuits involved in depression, circuits involved in planning activities. So guided imagery can be a very powerful modality, the relaxation that one experiences from it, in addition to the cognitive load on the mind. This was from a subset of Dr. Lavretsky's patients, and it looked at changes in the brain that were associated with memory changes. And I'm not going to spend too much time on this because it gets extremely technical. And even those of us who are supposed to know how it works, we don't really know exactly how it works. A little secret. But what they looked at was a circuit in the brain called the default mode network. Now, the default mode network is active in daydreaming. It's active in thinking about the intentions of others, recollecting information. And what they found was that connectivity changes in different aspects of the default mode network correlated with improvements in memory. So they could see that some of the circuitry that we feel underlies some facets of verbal learning and verbal memory was actually altered by the guided imagery. And it was also altered in similar ways by the memory enhancement training. So the red line on the graphs shows the correlation of connectivity changes in these areas with memory enhancement training, and the blue line shows the set of blue lines shows the correlation with yoga. The reason that there are two blue lines there is that there's one outlier which is circled, and without that they still saw the effect. So it appeared robust, although this was a subset of about 15 patients per group. I want to tell you a bit about Kirtan Kriya within its culture, because I think that it is very important to understand where these practices come from, particularly if you're deciding, do I want to do this particular form of practice? Because if you search for Kirtan Kriya online, then these are the first things that you'll find. If you put Kirtan Kriya into Google and you want to find practice exercises, I think you should be well informed about where it comes from. So Kirtan Kriya was brought to the US by Yogi Bhajan, who was a very renowned yoga practitioner from India, and he created a spiritual path called Kundalini Yoga. And so it really is quite spiritual. If you are doing Kundalini Yoga and practicing this, you may do it for hours. They note on their website that meditation done improperly, even in this sentence here, saying that meditations have coded actions and their reactions in the psyche, but because Kirtan Kriya is effective and exact, it can also lead to problems if not done properly. Say that is true if you're doing it for more than 2 hours. Yes, can I answer a question? So the question was, Kundalini Yoga is a sexual yoga. So I'd say that may be a way of conveying it in the West, but that's not its roots. So the term Kundalini refers in a very broad way to a spiritual energy that practitioners felt that they accessed. And so there may be certain subpopulations who refer to it in that kind of way, but within the tradition it has a very sacred aspect that has nothing to do with sex as well. So you'll find that that this is a form of spirituality for some people, and I think that's important for you to know. It's important to me as a physician because my patients come from all sorts of spiritual backgrounds. And so I want to do a Kirtan Kriya-like exercise with you, but not Kirtan Kriya itself, because for some people it may offend their sensibilities to be asked to do a practice that comes from a spiritual tradition and repeat syllables that have a certain spiritual meaning within those traditions. And for me as a person of faith, that is also important. So I decided to take a page from the playbook of one of my mentors. After I graduated from college, I went and worked in the laboratory of Herbert Benson, who is still at Harvard and now has the Benson Henry Institute at the Massachusetts General Hospital, which continues to train people in the relaxation response. This was a best-selling book back in the 80s. And what Herbert Benson did was he essentially looked at the techniques of transcendental meditation and said, well, that's interesting. I wonder if we can teach transcendental meditation in a way that would extract some of the principles and allow people to place it within their own cultural contexts. And so instead of using one of the transcendental meditation mantras, he had people choose their own mantras and do practices for about 20 minutes with it in a kind of form of verbal mental imagery. And then he studied that and has a whole body of research in association with that. So I thought that for us today, we could do about a 5-minute exercise. And instead of repeating Satanama, we could repeat loving water. What's more essential to life? I don't know that anyone would have a particular issue with the idea of loving water. So we'll do the whole rest of the Kirtan Kriya for about 5 minutes, just to get a sense of it. And so I'll get us started. You can join in if you're comfortable. If you're not comfortable verbalizing, it's okay for you just to sit with your eyes closed and listen and pay close attention. There's no need for you to force your mind to do anything it doesn't want to do. Just be present with what we're doing. And then at the end of about 4 minutes we'll start with a repetition, we'll move into silence, and then I'll guide you to imagine as if that light were coming down upon you and we're inside of you. And it's similar to the light that's coming down into this water and is reflected on this water. Before we start, I'll just say some of my psychiatry residents would call this kind of hokey. They're kind of like the Ebenezer Scrooges of guided imagery. They're like, Dr. Jain, what are you doing? They haven't yet seen the Ghosts of Christmas, which teach them that there is magic in the world. But I think this can be a very beautiful practice. So let's give it a go. And so again, you'll be using your thumb with each successive syllable to touch each finger, and then singing Loving Water with me, and we'll then whisper it, then we'll silently imagine it, and then we'll imagine the light. Okay. Loving water, loving water, loving water, loving water, loving water, loving water, loving water. Imagine the sounds continuing to resonate in your head. Now, as you continue to allow that sound to reverberate within you, I also wish to imagine as if that light were coming down upon you, that light over the water, coming down upon you, entering you, soothing your being. Bring your attention to your breathing. Bring your intention to the sensations on the surface of your skin. You can briefly scan through your body using your attention from head to toe and allow yourself to shift in whatever way is comfortable for you. You may wish to move your hands, even your legs or your feet. And when you're ready, open your eyes and bring your attention back to the room around. I'd like to ask if anyone would be willing to just say what they're feeling right now in this moment. Just a word, one word. Light, peace, warmth, calm. So these are very human kinds of experiences to have with this kind of practice. And a few things that I want to emphasize with it. It's done over a period of time. It's not that one repetition of a phrase such as this has that power. It takes time out of your day. But if you think about even doing a practice such as this for 20 minutes, you're still talking about less than 5% of your day, of your waking day. Less than 5% of your waking day that you can dedicate to you and help you to experience that, and perhaps to also derive some of the benefits that Dr. Lovretsky has found through her research with Kirtan Kriya. Now I'd like to shift gears. Before I do, let me also acknowledge that there may be some people who didn't feel any particular state change as they did this. And there always are some people who feel like for whatever reason they cannot do these kinds of practices. Their mind may be moving too fast. They may have a lot on their mind. They may be able to focus but just not experience a whole lot of benefit from it. And if you're in that boat, I think it really is helpful to seek aid with someone else, someone who's an expert in the kind of practice, to work with you, or a therapist, because having those kinds of experiences of calm, of peace, of relaxation is really helpful. It's really healing for your brain. And I think it is possible for many of us, for all of us really, to derive some sort of benefit, but it can be necessary to work with someone who's an expert on it. All right, so now I'd like to shift gears and talk to you about my own work, which is called Mentalizing Imagery Therapy. So kind of a funny word at the beginning of this, mentalizing. What is mentalizing? And it's not exactly what the TV show, The Mentalist, would have you think of it. So mentalizing is about how we understand our own minds and those of other people. So how we understand thoughts, motivations, feelings, drives, needs, all of those things that are essential for us to know about ourselves, to know about others in our life, to know about our loved ones. No matter the cognitive status of the individual, we still all have these things. And so mentalizing imagery therapy is about using imagery to help us gain a deeper understanding of our own mind and also about our loved ones' minds, which means that the practices are more active, they're more complex, they take a little bit more work to get into, so we're not going to exactly sample them today. But the goals are to find a safe internal harbor, so we do want people to be able to experience some of the calm, some of the peace that we heard today in the room, to increase the power to observe, to be present to yourself as a whole, to be present to both the positive and the negative without having that negative bother you to the same extent that it might. To help restructure relationships, to gain a greater understanding of yourself, your loved one, to remember connection with others, family, communities, environment, nature, your source, however you define it, whether it be a mystery of nature, whether it be God, whether it be something else. And to continue to shift perspectives within that, to better understand your place and how you're connected, and also to promote effectiveness with the challenges of caregiving. Here is what some caregivers, these are not only people, but they are people who actively care for a loved one with dementia and who went through our program. And we have been blessed throughout our research to have a participation of a really broad range of people from different ethnic backgrounds, different religious and spiritual backgrounds, and that's very important to us. So, quote, "I found greater acceptance of my own emotions. I didn't have to shove them away and think of myself as a bad person just because I was getting angry or upset." So often for so many people, the fact that they have an emotional reaction within a caregiving situation makes them feel miserable, makes them feel guilty, and that just perpetuates their distress. This person was able to experience more self-acceptance. Another person, "For the first time, I really stepped into my loved one's shoes and looked from their perspective. I better understood the shame that they experienced, and particularly they were referring to a situation where their loved one would be dropping food on the ground as they were eating. And normally they would become quite irritated by this. But after going through the series of guided imagery exercises, they were able to understand it better, not only from their own perspective and how they'd have to clean up, but also from their loved one's perspective. And that gave them a sense of greater connectedness and greater acceptance of the situation, and they didn't have as much irritation, which was really only harming them. Another caregiver, "I don't get totally pissed off, hopeless, drained. It lifts my mood, so I'm not depressed and dreading the day." So again, finding that safe internal harbor. We have some objective data as well from small numbers of caregivers, although our ongoing research, we've enrolled close to 50 people, and we still have a few spots available, which I'll mention again at the end. But in this particular study, we had 12 dementia caregivers go through as an open label just to see, is this feasible for people to do? Can they actually do it? Will they do it? And in this particular study, most of the people were white, some were African American, 2 dropped out due to caregiving challenges, and then others came about, well, more than 90% of the time. They practiced regularly. There were encouraging findings for depression on the top, anxiety on the bottom, and these lasted about 3 months, at least 3 months. We didn't know beyond that, but we saw immediate decreases from before to after the program. This was an 8-week version. We've since refined it to 4 weeks. And then 3 months later, we continued to see reductions in levels of these symptoms. And we saw increases in factors of what's known as mindfulness. So mindfulness is a quality of being present in the moment, non-judgmentally, being aware. And we saw increases in several facets of mindfulness, including acting with awareness, not judging experience, being able to observe what they were experiencing. And we also had the privilege of doing some brain imaging, both structural and functional, and looking at gray matter volume change. Again, this is a low number of subjects. It's uncontrolled. It's data from before to after. But on the left side, the leftmost image on the top, the left part of it is the back, the front part of it is the front, and the green is essentially areas where we observed some increased thickness. In the red, areas of relatively reduced thickness, indicating, or I should say volume change, which is slightly different from thickness, but a related type of measure. And so at a very rough threshold where we didn't correct for multiple comparisons across the whole brain, which is a statistical no-no, but it gives you a nice sense of a pattern for a small study. We saw essentially that within prefrontal cortical regions important for planning activity, important for social emotions, for caring, for organizing, we saw relative volume increases. And at more stringent levels, again, we saw within the prefrontal cortex, within regions of the orbitofrontal cortex, and then also in somatosensory regions, areas of increased volume. We don't know exactly what this means because this was after 4 weeks. It's probably not sprouting of new neurons. It could be increased blood flow in these areas. It could be possibly increased dendrite thickness. It's hard to exactly know what to make of them. These are MRI correlates of gray matter volume. And then secondly, we looked at functional changes within the brain relative to a control condition in which people received a relaxation CD. and changes in connectivity of the amygdala, which is a region deep in the brain that's associated with strong emotions and processing of strong emotions. And we saw, without going into great detail, we saw increased connectivity with prefrontal cortex on the left side, the left superior frontal gyrus. If you're looking at the top brain on the left side, you'll say, wait, that looks like the right side. And the reason that it's mapped out in this incredibly ridiculous way is that radiologists have a specific convention in which they put the right side on the left side. So on the left side on the right side, which confuses me because I already have enough problems with left and right. But the left prefrontal cortex associated with happiness or approach-oriented behaviors, in the right side, broadly speaking, associated with avoidance-mediated behaviors, although this is mostly from the EEG literature. We saw a relative increased connectedness of the amygdala to the to the left prefrontal cortex, decreased to the right prefrontal cortex, potentially suggesting more regulation of the amygdala by some regions of the prefrontal cortex involved with positive emotions and less surrounding negative emotions. But that, again, that's speculation. We don't really know kind of what this exactly means. But it's always intriguing to try to make sense out of these pictures. So, in summary, guided imagery exercises can be helpful for patients with dementia, with cognitive impairment, as well as their caregivers. Mentalizing imagery therapy, or MIT, so named to make it sound smart, like the school, is a set of practices meant to help improve perspective taking, enhance connectedness, and stimulate interpersonal problem solving. To my knowledge, it's really the only guided imagery therapy taking this approach, and we have some promising initial clinical and neuroimaging data, but a need for ongoing research. So I want to put a plug in for our current study. There's an in-person caregiver trial which offers 4 weeks of therapy, and you're randomly assigned to get facilitated discussions, which we also believe are a very active and powerful form of treatment, or to get the imagery exercises. And if you cannot come into UCSF itself, there's also an app-based intervention study that's very similar to this, just using a smartphone, and you interact with us remotely, and you can sign up for this if you're a caregiver. And the best part about being involved in research is that it's free. So acknowledgments to many of the people who were collaborators at multiple institutions, from UCLA, where I devised much of this, to University College London. Now at UCSF we have some collaborators, and then we're moving to Harvard in February. Thank you very much for your kind attention.